Welcome to the Anatomy Dissection Laboratory for students. In this video, we will dissect the larynx. Drs. Carlos Suarez-Quian and Joel Valensky are the authors of this presentation. Dr. Suarez-Quian is a narrator. Speech has been pivotal to the evolution of the human species. The larynx is primarily responsible for giving us the ability to speak and to sing. As Josh Groban said, there's no half singing in the shower. You're either a rock star or an opera diva. And students are always amazed when they see for the first time how small our true vocal cords really are. Let's dissect the larynx. The ideal approach to gain entry into the larynx is a posterior one. It is precisely where we reflected the head in the previous laboratory. Shown on the left-hand image is a bisected cadaver, and on the right, the approximate area of the larynx of the cadaver in which the head and neck were reflected anteriorly. The goal now is to incise the pharyngeal constrictors to gain access to the larynx. But when we do, we first gain access to the laryngopharynx, the third space of the pharynx, and the gateway to the larynx or the alimentary canal, where the two intermingle and the reason for why choking can be a real issue. Food that travels into the larynx will impede respiration and, if not removed, will lead to choking and death. Let's now move back to the dissection and examine the relationships of the larynx to the pharyngeal constrictors in a cadaver in which the palate and tongue have also been bisected. This grants greater exposure to the specific area of the larynx and will allow us to clearly label pertinent structures. First, let's look at structures we already know. The pharyngeal constrictors have been partially cut open, and below, the beginning of the esophagus is indicated. The epiglottis is evident. This marks the highest point of the laryngopharynx. And along with the aryepiglottic fold, it demarcates the vestibule of the larynx. The vestibule, in essence, represents the beginning of the larynx. Next, the pharyngeal constrictors in the esophagus were completely split open. Between the cut constrictors and the walls of the larynx is a space, the piriform recess. Food particles, even chicken bones, can get caught here and may be the reason for severe halitosis or worse, choking in individuals. And if we remove the mucosa from the piriform space using scissor technique, we expose two nerves. The one entering the piriform recess from above is the internal branch of the superior laryngeal nerve. This will be sensory to above the vocal cords. It is responsible for the cough reflex. That is, when a food item enters the larynx, contact with the mucosa of the larynx, which is innervated by this nerve, triggers a cough in an effort to expel the food item. The nerves entering from below are the termination of the recurrent laryngeal nerves. These will be motor to all muscles of the larynx except one, the cricothyroid, and sensory to below the vocal cords. To look for the muscles of the larynx, let's start with a fresh dissection indicated in the slide. Neither the palate nor the tongue have been bisected in this cadaver. Note again the epiglottis, aryepiglottic fold, and the vestibule of the larynx. We use scissor technique to remove the mucosa that is basically covering the muscles of the larynx. The superior muscle is covering the arytenoid cartilages and functions to adduct the vocal cords. It is a transverse arytenoid. The inferior muscle is a posterior cricoid arytenoid and takes its origin from the large lamina of the cricoid cartilage. It is the only muscle capable of abducting the vocal cords and thus maintain airway patency. Once again, note the nerves in the piriform rhesus, the internal laryngeal and the recurrent laryngeal. In this dissection, the right recurrent laryngeal was preserved, arising from the right vagus. Recall that the left recurrent laryngeal nerve arises from the left vagus, but in the thorax. The next step in the dissection is to cut the muscles and spread the larynx as shown in the next slide. With the larynx open, we can now identify pertinent structures. To get our bearings, let's label the epiglottis and the epiglottic fold. And now we can distinguish the vestibular fold, the false vocal cord, from the true vocal cord or vocal fold. In between the two folds is the ventricle. Finally, below the larynx, we observe the rings of the trachea. To better understand the arrangement of the cartilages and the ligaments of the larynx, the skeleton of the larynx was isolated and is shown from the front. Observe the following: the epiglottis, the body of the hyoid bone, the thyroid membrane, the laryngeal prominence of the thyroid cartilage. This is your Adam's apple. The lamina of the thyroid cartilage, the cricothyroid membrane, the location where an emergency cricothyrotomy is performed, the arch of the cricoid cartilage, tracheal rings, and in this image too, we see a muscle of the larynx, the cricothyroid, and a strap muscle that was kept, the thyroid. And note that I switched to red lettering to indicate the muscle. I continue this practice in all subsequent slides in this presentation. We now see the larynx and hyoid bone from the side. The aforementioned structures are now labeled. Stop the movie a second to review. The thyroid lamina now needs to be cut and left on its hinge, as shown in the next slide. On the left image, I again show the larynx from behind, and on the right image, I show the thyroid lamina after it was cut and left attached by a hinge. To accomplish this hinge, we first cut the articulation of the inferior horn of the thyroid to the cricoid cartilage, then use a scalpel to separate the right thyroid lamina and leave it hanging by its hinge, as shown on the right panel. The thyroid articular surface that was cut in step 1 is not clearly visible, as is the hinge that was made on the thyroid lamina. We again see the posterior cricoid muscle, this time from the side, and two new muscles, the lateral cricoid and the thyroid. The lateral cricoid adducts the vocal cords. The thyroid loosens them. Makes you speak in a deeper tone. And now look at the location of the recurrent laryngeal nerve, just posterior to the thyroid articular surface. This is an important clinical relationship for otolaryngologists. Looking at another isolated larynx from the front, we again label all the prominent structures on the right-hand side of the image you should be able to recognize. Now identify the right internal branch of the superior laryngeal nerve entering the thyroid membrane, and the right recurrent laryngeal nerve approaching the larynx from below. Note that the recurrent laryngeal branches are located lateral to the trachea. The golden rule when performing a tracheotomy is stay to the midline. Now you know. This now completes the dissection of the larynx.